Are coronavirus deaths showing up in weekly deaths from pneumonia and influenza? March 22nd, 2020. So here I'm talking about the coronavirus COVID-19 pandemic that is causing lots of panic and fear throughout the world and in the United States. And the question is, how deadly is it? So the issue here is it's been presented in the media as a super disease with an unusually high mortality rate. And by that is meant a higher death rate than we see with the various viruses, bacteria, and other causes that are classified as pneumonia and influenza in official statistics. So every year in the United States, about 55,000 people die from pneumonia and influenza. And actually many more die from pneumonia than influenza, according to the official statistics. The concern about coronavirus is that it has a much higher mortality rate than influenza, than the kinds of diseases that we classify as flus or common colds, a lot of popular terminology. Is that actually true? Can we see? Well, if a new disease were to appear for whatever reason, it doesn't have to be coronavirus, it could be anything, which has a substantially higher mortality rate, then it will show up in deaths attributed to pneumonia and influenza. These are monitored on a weekly basis by the government, by the National Center for Health Statistics and the Centers for Disease Control. So they actually have weekly totals of how many people died in the last week, or actually a couple weeks ago, for who died. So if there's some super disease out there, it will pop up as a spike, a dramatic increase in these deaths in the weekly data, which we already have up until March 7th of 2020, at least according to the CDC website. So the question becomes, are we seeing such a spike? So if coronavirus, for example, is unusually deadly, and particularly if it reached the United States, assuming it did come from China and wasn't already present, if it reached the United States, say in December or a couple months ago, it would have been happily killing people for some time and would show up in these official statistics of weekly deaths. And even if it's relatively recent, say a few months ago or a month ago, let's say beginning of February, for example, if it is unusually deadly, unusually virulent, it would start to show up at some point. Now, there are a lot of qualifications to that, and I'll give those in a minute. But at least we can check and see if there's any evidence of a spike in deaths showing up in the statistics. And in a nutshell, the answer is so far no. So this is what I'm talking about. This is the pneumonia and influenza mortality surveillance by the CDC. So this is directly from their website. I'm going to read a little bit of it because this is the data that I'm using. So it's based on National Center for Health Statistics, NCHS mortality surveillance data available on March 19th, 2020. Now that is actually deaths up to the end of the week ending in March 7th, 2020, according to the website. Now this is week 10 according to however they put this together. So whatever the end of week 10 is, we have numbers up to that point. This plot on the CDC website shows the rate, the percentage of deaths attributed to pneumonia and influenza. Now it has a periodic fluctuation. It's seasonal, so during the winter, during the time periods when the sun is weaker, you see a significant increase in deaths due to pneumonia and influenza. And this is a rate, and so actually it's somewhat declining. We'll get to that a little bit more in the future, later in the talk, I should say, later in this presentation. The data I got was from clicking on this view chart data, which has comma-separated values files, which contain the actual specific numbers up until a couple weeks ago. Week 10 is supposedly ending on March 7th. So let's just quickly look at it without any fancy methods or data analysis, without artificial intelligence or machine learning or any of that. Just look at it by eye. So here are the numbers. So this is all the same file, by the way. I'm just showing the data at the very end for 2020. So this is the same file, which we'll get to in a minute. So in week 10, the most recent one we have statistics for in 2020, so that's the week ending March 7th, 2,258 people died from pneumonia, and 347 died from influenza. A year ago in week 10, so 1 year ago in 2019, the numbers were 3,746 people dying from pneumonia and 544 dying from influenza. So significantly higher. I mean, a lot higher last year. There's actually more deaths a year ago in comparable time of the year than this year. And in fact, if you look at this data, and I'll show a plot in a little while, you see it's dropping dramatically. There's no sort of unexplained flattening out or something that would be seen if there were a significant number of deaths occurring from a new extremely deadly disease or deadly disease. So in fact, there's no sign yet in this data, and I say yet, so far it doesn't show any indication whatsoever that there's some kind of new, unusually deadly virus, bacteria, anything, whether it's coronavirus or something else in the data. So again, I'm just highlighting the data from the 10th week of 2020, and you can see again 2,258 deaths from pneumonia, 347 from influenza, and the 10th week of last year, 2019, had 3,746 deaths from pneumonia and 544 from influenza. So this doesn't show any sign of any kind of increase. I will add the caveat that these are collected through a complicated system. They may be adjusted in ways that are not clearly documented by CDC. There may be various subtleties involved in the numbers that I haven't figured out or aren't documented very well on the CDC website. That's always possible, but they don't show any sign of something new as presented on the CDC website. Okay, so let's try to dig down a little bit further. So I try to do a little bit of understanding of the mathematics. This is very preliminary. It's a low fidelity model constructed by our math recognition software. And so what I think is probably most relevant is the data source is this file nchs data 1111 from their website, and I summed together the number of deaths from pneumonia and the number of deaths from influenza, and I plot that total number. In principle, the coronavirus is not a typical influenza virus, so it probably is the case that any coronavirus deaths would not be put in influenza category, since they wouldn't, without the new tests, they probably wouldn't show up as influenza, but I may misunderstand how they're doing things. So what we can say with a lot of certainty is if there was a coronavirus case, say in January, before it got a lot of publicity, and a doctor encountered it and the patient died from it, they would probably report the coronavirus death as either pneumonia or influenza. And assuming the coronavirus can't fake out influenza tests and pretend to be an influenza virus, then it would show up in pneumonia, but I don't understand all the subtleties of it, so we combine the two and see if there's a significant increase occurring in these deaths. To really understand it, we need to understand the mathematics, the probabilities of just the normal viruses that aren't as deadly as people are claiming or hypothesizing coronavirus to be. What will they do? What could they, how much do they fluctuate, etc. Okay, so I'm going to stop for a moment, and this is the legal disclaimer in our report, but I just want to emphasize the section on the professional disclaimer. This report and this report cannot and does not contain medical, legal, fitness, health, financial, or other advice. The medical, legal, fitness, health, financial, or other information is provided for general informational and educational purposes only and is not a substitute for professional advice. Accordingly, before taking any actions based on such information, we encourage you to consult with the appropriate professionals. We do not provide any kind of medical, legal, fitness, health, financial, or other professional advice. The use or reliance of any information contained in this report is solely at your own risk. So in the case of things like the coronavirus, we're talking about medical doctors, public health authorities, and officials, and so forth. Respiratory illnesses, whether they're the coronavirus or not, and whatever is actually going on right now, are very serious. They're one of the leading causes of death in the country. The rule of thumb is that if you can't get oxygen for 4 minutes, it kills you. You really need oxygen, and that's one of the reasons that respiratory infections are a leading cause of death. So do take it seriously and take appropriate action and precautions. This is a plot of the data where I've summed together the pneumonia and influenza deaths for each week to give a total. The basic point, again, is that if you have a new disease, which is unusually deadly, not your typical, common cold, not your typical influenza, not your typical diseases that happen every year and that cause something in the range of about 55,000 deaths per year in the United States, then it would actually show up fairly quickly as an increase in deaths at a weekly level. So it would show up in these statistics if there was a really serious kind of super disease at work. So what we mean by super disease is something like what the Black Death apparently was in the 14th century, what smallpox was apparently for American Indians, and what arguably the Spanish influenza or swine flu epidemic in 1918, 1919 was for people all over the world. So you can see that there's this seasonal variation. Now, on the vertical axis, we have the weekly deaths. And it doesn't start at 0. So right now at the lower right corner, the last point is around 2,600 deaths in the last week, in week 10, the week ending March 7th. So you can see it kind of goes up and down, and it varies a lot. You can see, for example, that in 2018 there was quite a large spike. There was also something of a spike in 2015. It's not exactly the sine curve, a periodic motion like a pendulum. It's very close, but it's not quite the same, and it has a lot of what appears to be unexplained variability, although again, you don't see truly a super disease in this data. This data is from 2013 to March of 2020. So what we do is we look at the distribution of the changes from week to week. So a change could be a 5% increase, a 5% decrease, and it's correlated from week to week. So you tend to have the period where it's going up, and then you have a period when it's going down. And we try to construct a model of the distribution of these weekly changes. This is a low fidelity model, and it doesn't capture the seasonal variation. We're kind of just looking at the overall trends and pattern of this data and what you might expect just projecting forward what could happen. So what we do is we apply an artificial intelligence program using state-of-the-art AI and pattern recognition and other methods. And these are methods that can be run on ordinary computers. We don't need a giant supercomputer data center type computer like Google has or some other companies have that's bigger than a city basically trying to do it. These methods are much more efficient than the deep learning methods, for example, that you hear a lot about right now. So they are doable on less advanced, or not less advanced, but smaller, low power computers. But they can still, what we're trying to do here is recognize what the mathematics is in the data. So in other words, it could be, for example, the bell curve. We'll see it actually does look a lot like the bell curve, but we want to imitate what a human being can do and look at the data and say it actually looks like this mathematics. In particular, we're trying to extract a differential equation, technically a stochastic differential equation. That's some mathematical jargon that will actually explain the data. So we find a number of candidates. In our system, we always look for the bell curve, and we always actually analyze the bell curve even if we know that it's a pretty bad model. It actually is a good model for this data right now. And we also look at something called the Cauchy, and I'll explain the bell curve and the Cauchy and their relationship shortly. We also find that it's pretty similar to the bell curve times something called the Gumbel and the Moyle function. I don't actually, since the winner is actually the bell curve multiplied by the bell curve to produce this, I went too far, to produce this shape, you multiply the bell curve for one change and multiplied by the bell curve for a change in a subsequent or previous week. Actually, it's a subsequent week. That's probably fairly technical, but the point is we do find in our database, which is a database of hundreds of known mathematical objects, things like functions like the bell curve and differential equations and so forth, we find that this is a good candidate. So let me explain what the bell curve is and what the Cauchy function are and why they're important. And we, in fact, will always do an analysis assuming that those might be the models for point of comparison to other analyses by other systems or by scientists or the government or whoever is producing the analysis. We also include Cauchy because, as I'll explain, it's a good way of representing a distribution that looks a lot like the bell curve but has a much higher risk typically So let me explain what's going on here. The bell curve, probably you've encountered this in being graded on a curve in high school or college or SAT tests, things like that. It's also known as the normal and the Gaussian, after Carl Friedrich Gauss, the famous 19th century mathematician. It looks a lot like the profile of a bell, hence the name bell curve. And it represents the probability of getting a value, say at 0 at the peak is pretty high, value at 1 is much lower, value at 2 is getting really low. What's significant about the bell curve is the probability of getting a value away from the peak is very low. It rapidly goes to 0. It, quote, exponentially, unquote, decreases to 0. So it's very flat, and your probability of sort of an outlier, of some unusual value, is actually very, very low. So you get like 1 in a million, 1 in a trillion chances of being out here. Okay, so what that means is the Gaussian, or the bell curve, is often a good model for things like the distribution of height, like the distribution of grades or IQ test scores, various other things. There are theoretical reasons why that's true, so it's used widely and it's also overused. And it usually doesn't model some systems that have high risks or frequent outliers. So what's an example of that? Financial investments. We have these stock market crashes, we have real estate crashes. Those crashes correspond to an event out here, somewhere out here. So during the build up to the housing market crash in 2008, the financial crash, a lot of the models used on Wall Street for mortgage-backed securities and other securities actually used something they basically used the bell curve or something derived from the bell curve that understated these risks significantly. They should have used some other model. There are other situations where this could happen. For example, it may well arise in epidemiology where we see historically these examples of sort of seeming super diseases like the swine flu, Spanish influenza epidemic in 1918, again smallpox with the American Indians, and for example the Black Death or the Black Plague in the 14th century, the mid 1300s. Okay. In contrast, the Cauchy, which also looks a lot like a peak, has a very long tail, and it has a higher probability of outliers. The Cauchy is not as well known as the bell curve. I'm sure most people who are listening to this have probably never heard of the Cauchy. It turns up in various applications in physics. It, for example, turns out to be, so if you envision that I have a table or a mirror and I put a light above that mirror at a height like here, what is the intensity of the light on that surface as you go along here? Well, it turns out that intensity is the Cauchy distribution. So some of the light will go off in a straight line here and end up basically out at infinity, and it gives this distribution. So that's an everyday example of where the Cauchy distribution turns up. And it turns up in various places in nuclear physics and particle physics and various kind of optics problems like my example that I give. So again, just to explain what the Cauchy is in sort of everyday terms, if I suspended a light, let's say 3 feet above a table, and I wanted to measure the intensity along that surface of the table as I moved away from the point where the light is suspended above, I would see that that distribution is actually the Cauchy, and it has this kind of shape with a long tail, much longer. It doesn't flatten out to 0. It is not like the bell curve. You don't see the bell curve distribution. So in certain systems with certain characteristics, the structure of them will produce a Cauchy distribution and not the bell curve, which is a much, in general, often corresponds to a higher risk situation than using the bell curve. Okay, so this is a table showing our winners, our top matches. So again, the math recognition looks at the data and says, hey, this kind of looks like a bell curve. This kind of looks like the Cauchy. This kind of looks like the Gumbel. It's an obscure function, a Moyle function. And it ranks them according to how well they match the data. And it uses something called R squared. And there's a technical definition of R squared. It's known as the coefficient of determination, some other names. And I'm not going to go into that, but largely you can think of this as the percentage of the data explained by your model. So if you had 0% here, a value of 0, it would mean you totally failed, your model doesn't work at all. 50% would be kind of marginal. 100% would mean your model is perfect. You're able to predict everything that's happening in the system. You have a perfect model. Now, it's a little more complicated than that. You can actually get negative values for r squared, but those mean your model failed terribly. But for most of the time, you can interpret it this way, which is what I'm doing here to explain it to a general audience. So the point is, I get about 95% explanation of my data, and there are various qualifications I'm not going to go into in this presentation, for a fairly simple model, which is the bell curve. And in fact, we can also have the bell curve in the Cauchy, for example. So I'm just going to look at these two top winners for now. So what do they project? What does this tell us about what might happen in the future, and what are the odds, let's say, of a super disease or a substantial increase in mortality from diseases that are typically classified, or the deaths are classified, as pneumonia and influenza? Well, the good news is the blue line here is the median, what the deaths are going to be, and this is weekly death rates, so the number of people dying per week. And it's sort of averaged over the year here, so we don't actually capture the seasonal variation. But what's the future going to bring? Well, let me go back a little ways just to remind people of the data. You can really see this in the, here we go. So this is the data. This is the weekly deaths. This is the raw numbers from the government. You can see that there's kind of a downward trend here. Although, again, we have these spikes here, so take that with a little caution. But there appears to be a downward trend. So fewer people are dying, say, in 2020 on average, at least so far this year, in 2020, late 2019. This season, actually, fewer people are dying than were in 2014. Okay, you can see this kind of downward trend. And the model is capturing that downward trend. And so the median, which is about actually kind of the most likely outcome in the future, shows that in 10 years, it's very possible no one will die from these diseases. What is it capturing? We don't, the math can't really tell us, but probably improvements in healthcare, improvements in sanitation, better food, the kind of factors that over the last couple of centuries have dramatically lowered deaths from pneumonia and influenza, are things today would be classified as pneumonia and influenza. In fact, it could be a lot better. There's a 50% chance it would be even better. However, there's a lot of variation in the data, right? You could see that, the spikes from year to year. And so it's possible that we could see a significant increase. So we have, this is the 95% confidence level. So it's not the worst case, but it means that 95% of the time, if we could somehow repeat the future over and over again, it probably would never rise above, say, 15,000 or 17,000 deaths per week. But that's a huge increase over the current rate. So this upper area here is kind of the risk of some sort of something going wrong. It could be a super disease like people are afraid of. It could be something else. Now keep in mind, this is a very low fidelity model, and don't take these numbers too seriously. It's just to illustrate the concept. And we actually get a fairly similar, oh, by the way, let me stop and mention this. So these are, what I did to produce those is I simulate 1,000 futures. The next 10 years 1,000 times using these random number distributions. So it's like flipping a coin with a certain probability, except it's more complex. I'm using the bell curve distribution or the Cauchy distribution. What I want to see is, what does each of these futures look like? Well, you can see they vary a lot. We could have a future like this green one where the rates actually go up in the future. Mostly not. You can see most of them, it's going down towards zero, as we would expect from the trend in the data. The data seems to have a systematic trend downward. But there's no guarantee, right? We could have really bad luck. We could have a super disease occur, what people are afraid of with the coronavirus. That could occur. So this is the Cauchy norm. Now remember, the Cauchy is actually riskier, although it doesn't really show up to. You can see a little bit of a difference here that's coming from the Cauchy, probably. In other words, the other one, the bell curve in both components, the bell curve in both, it starts to turn back down, doesn't get quite as bad. But the Cauchy is coming in here probably and pushing it up a bit. So actually the Cauchy isn't here producing like a dramatically greater risk of something happening. But the Cauchy has very large outliers every now and then compared to the bell curve. And so it is certainly a more conservative way of estimating the risks in the future. Now, one of the problems is because the difference is out on the tails, we usually don't have a lot of data which will tell us what the tail is like, whether it's really like the bell curve or really like the Cauchy. And that's why these models are both showing up as winners, and they overlap statistically. You can't really tell them apart. in this data. And here you can see 5 of the 1,000 predictions with the Cauchy normal bell curve model. You can see it doesn't drop as sharply in these, and you get more stuff jumping around. And that's probably the effect of the Cauchy part of the model. So the Cauchy, again, has these long tails. It has a higher risk of outliers. Those can be good outliers, so they could be like we make a dramatic technological advance and like penicillin or something, and that reduces the death, but it can be something bad, like a mutated super virus that is immune to anything we have, basically, and very hard on human beings. So in conclusion, let's walk back to where I started, which was the question of whether we can see any increase in deaths from the coronavirus. If the coronavirus, COVID-19, is unusually deadly, so we're saying it kills more people when you get infected with it, for example, it is deadlier than typical influenza viruses that people are exposed to, or the many things that cause pneumonia, which actually kills far more people than influenza viruses. So other viruses, whatever. So it's way out there for some reason. It's a super virus. Well, if that was the case, even if we don't have tests for coronavirus, and many people, we don't have tests yet. A lot of people are just getting tested. Even if those tests don't work right, even if they have high false positive rates, they will always have false positive, false negative rates. But even though those tests are just totally useless, those tests aren't working right, they're giving us the wrong information. Even if we have a lot of misdiagnosis of this new disease that we've supposedly never seen before, we will see this increased mortality, these deadly character of the virus show up in who dies. And unless there's some real fiddling going on with the numbers, they should turn up in the category of pneumonia and influenza. So the question is, are we actually seeing that yet? The answer appears to be no. So as of March 7th, 2020, the coronavirus, COVID-19, has not significantly added to deaths attributed to pneumonia and influenza. In fact, so far, reported weekly deaths are lower than in 2019. A large increase in weekly deaths is expected if coronavirus, COVID-19, is unusually deadly. It is too early to rule out an unusually deadly disease. We will probably have sufficient statistics within a month or two. That's not absolutely certain, but that's very likely, and we'll be able to tell if people are dying from some cause. Even if we don't have tests to confirm it's coronavirus, we can say, wait, these weekly death rates are going up, whereas they're actually supposed to go down as the so-called flu season ends and we go into the summer. We should expect to see them drop dramatically as they do in previous years. And if they somehow go up a lot, well, I'm not going to give numbers right now, and maybe in a later presentation or video or article I'll show what those numbers might be. But the bottom line is we can tell if something really bad is happening from those numbers, independent of the tests and all that kind of stuff, which we probably don't have a good test and don't really know. It's very new. It's a very new disease, so we may not be able to tell. But again, these numbers, unless they're monkeyed with or something goes wrong with collecting them or something like that is happening, they should tell us if this disease is unusually deadly, and indeed very likely we can extract from them how deadly it is. But that's a bit harder. So this concludes this video, which was produced on Sunday, March 22nd, 2020. And I want to end with one other point, just a qualification, which is a very rapidly developing situation. So these numbers and all of this discussion may be significantly out of date even within a few days. Probably not. It'll probably take a few months to clarify what the situation is. But nonetheless, keep in mind this is a rapidly changing situation, and you can find original data directly at the CDC website and other associated official websites. So be well and take care of yourself, and hopefully this will all blow over. If you like this video, please take a moment to click like. Please click subscribe and the notification bell if you would like to receive more content from us. We welcome constructive feedback and comments. Mathematical software is developing products and services to automate data analysis, reducing the risks of costly errors and improving results. If you want to support our work, you can subscribe on our Patreon page. This is the URL for our Patreon page. Scan the QR code in the lower right corner with your smartphone to get the Patreon link. Our Patreon link is also in the show notes below.